morning, everyone, and thank you very much for joining us today. It is, of course, the second day of the European celebration of the 15th edition of the European Patient Rights Day, and as always organised by Active Citizenship Network to stress the principles hosted in the European Charter of Patients' Rights. Now, yesterday we had a lot of discussion about informing ourselves. We were all thinking about how we can contribute, with no one excluded, to a more resilient healthcare service throughout the EU. And we considered concrete situations, real experiences, ordinary and extraordinary, and it has been an extraordinary couple of years, but the things that have been put in place by the civic and patient associations. So we did this to emphasise the current contribution and the future contribution that we all look forward to in ensuring the future consequences of the COVID-19 pandemic don't derail our healthcare systems as a whole. More generally, we looked at the issue of potential serious cross-border healthcare threats and how we can work together more as a European community with the support of institutions for the benefits of local communities and the constituency. Now, today we're going to start the debate, as always, with a multi-stakeholder approach with two very specific inputs. You're going to hear a lot about these today. Firstly, the manifesto for a European Health Union. And joining us to present that, we're very pleased we have former European Commissioner for Health and Food Safety, Vytenis Andriukaitis. So we're delighted that you can be here. I'll give the floor to you in a moment. Secondly, a document also promoted by the Active Citizenship Network, and that's in cooperation with 29 associations who have already signed up to support this, and it's 10 concrete recommendations towards a European health union from a citizens and patients perspective. Now, this event over the last couple of days is very timely because we've got that conference on the future of Europe coming up in just a matter of days. And of course, all of us tuning in today very much hope that healthcare will be at the heart of the discussions. And then, of course, later on, going ahead later on in May, we have the next Global Health Summit. So we will also hear a little bit about that from Paola, I'm sure. I do want to encourage everyone to get involved, to ask questions. We have quite a tight schedule with a lot of really high-level speakers, but if you, the audience, want to put your questions to them, please do so. There is a Q&A button down at the bottom of your screen. You should be able to see it. It has a little chat icon. Please use that for questions for our panelists. If you can keep them concise and be as clear as possible, that'll make my life easier. And also, if you can indicate to which speaker your question is directed. If it's for all panelists, that's fine, you can say that, but if it's for one specific speaker, also give me that clue as well. In the chat, we're just going to share some thoughts, but that's not for questions. I'll be keeping an eye on the Q&A button for your questions. And I see so many of you always using the chat to say hello and greetings from where you are across Europe and possibly further beyond. That is one of the benefits now that we have working virtually and digitally, is that we can reach many more people. Also, of course, there is a hashtag. This is 2021 after all, and we do want you to share your thoughts with the wider world on social media, and that's EPRD 2021. So do use that hashtag if you're sharing comments on social media. We would love to get this spread out to the wider world as well as those of you tuned in today. Now, with that, I'm going to give the floor first and foremost to MEP Tomislav Sokol, who is particularly interested in health issues, particularly around patients' rights, as you are on the MEP interest groups on patients' rights and cross-border healthcare. So I will hand over the floor to you now and give us your opening comments about why this is so important today.
Thank you very much. Thank you for inviting me. And of course, I would like to to thank all the other panelists and all the people who are attending this important event. I think this is very timely because, of course, COVID-19 pandemic is the main topic, but and of course, there are priorities, especially now with vaccination and enabling free movement and return to normal life, hopefully. But I think that the pandemic has also shown us that we need to think in more long term about what kind of healthcare systems we need in the European Union, how to make these healthcare systems prepared and resilient for future crises, which probably will come. I would like to speak not in general terms, theoretical terms, but to focus on what EU can do in terms of building more resilient healthcare system. Because I'm obviously an MEP, and the problem with European Union health policy traditionally is that we didn't have one. So we had some ad hoc pieces of legislation here and there, but they were in most cases answers to some specific questions that emerged either because of Court of Justice case law or some other issues as well. So I think that what this crisis has shown us that we need more systematic approach of the EU, and that there are many problems on the level of healthcare systems which member states cannot resolve by themselves. So this division of competence, whereby member states have primary competence to regulate healthcare, is not something that can be used as an alibi not to do anything on EU level. And the crisis has actually shown us that when the EU has started doing something, then things started to improve. Just one example, and I think this is one of the most important issues that we will have to think of also in the long term, and that is coordination. So the crisis has shown us, especially in the beginning, that we need more coordination. So in terms of enabling free movement, in terms of epidemiological conditions, which are different and are still unfortunately different across the member states, different rules of free movement of goods. So we had limitations in terms of export restrictions on medical supplies, medicines, medical equipment, etc. So all of these things which emerged as a problem in the early months of the pandemic, and which were a big problem for the countries which were most strongly affected by the pandemic, like Italy, Spain, etc., where they had lack of medical equipment and supplies in the beginning. So the first thing that I would like to stress is that I think that on EU level, we need strong protocols and strong rules on how to enable free movement of goods and people during the public health crisis. So clear rules, of course, which will, on one hand, enable free movement, but on the other hand, also protect public health and protect citizens from disease. So have clear rules, for instance, green lanes, green passes on the borders, so that we make sure that the most important supplies can flow freely across member state borders. Because without this, we cannot have an efficient reaction to the crisis, and we cannot have healthcare systems which will be able to bear a new crisis that may come. Second, what is also shown us that we need a stronger institutional framework on the EU level. So a stronger early warning system, stronger place where decisions are made. We need better organization of civil protection in general terms, so to people who will be trained to act in case of medical emergencies, which are not healthcare professionals but can do many important things which have to be done on the level of the whole society. And what we also need is the common organization of supplies and stocks on EU level. So there are some crucial supplies, some crucial products that need to be stockpiled on EU level, so that when a new crisis comes, that we can act swiftly without having the problems that we had in the beginning of the crisis, that we lacked a lot of essential products which were necessary to tackle the crisis. Also, what I think that we can do on EU level is to enable member states to have better allocation of resources. So the costs of healthcare systems are on the rise. There are big differences between different member states, but there are a lot of irrationalities, a lot of duplication of different procedures. So I think that there are some things like health technology assessment which need to be simplified, which can be centralized to some extent, and so not to have 27 different procedures, for instance, for approval of new medicines, for reimbursement of new medicines, but to really have some kind of a system organized on EU level, which would also include cost effectiveness. Unlike the current proposal that we have on HTA regulation, I think that we can go even further, and I think that we can also including making cost effectiveness analysis on European level will make it much easier and much cheaper for national healthcare systems to make better decisions in terms of allocation of resources. Also, one thing which is very important is procurement. So joint procurement, we have the joint procurement of vaccines. There were some problems in the beginning with this, but I think in the long run, especially in crisis like this, in terms of crucial medical supplies, joint procurement has no alternative. And I mean specifically for smaller and member states with smaller amounts of resources, which just in case of there is 37 different individual procurements for essential supplies will be left behind. So first, the richer member states and bigger member states will get everything that they need, and smaller member states with less production capacities will be left behind. They will be in the end of the line when getting medical supplies and medical equipment. So this is something which is completely unacceptable. There are big differences that exist on the level of European Union in terms of different healthcare systems. So we need to make these common systems, this common procurement to reduce expenses and put everybody in the same position. And also connected to this, when we speak of differences in terms of healthcare systems, we also need investments. And I believe that European Union with its cohesion policy and EU for Health program can do a lot in terms of reducing inequalities that exist in terms of availability of healthcare, top health quality healthcare services, in terms of lack of numbers of healthcare professionals and medical infrastructure in general. So cohesion policy's main objective is to reduce inequalities in terms of development across the European Union. I think that healthcare and enabling equal access to healthcare services in general, and to have equal level of medical infrastructure in different healthcare systems is something where cohesion policy and EU budget can do its part. I think that we can reduce these differences that exist today. And finally, there is data. So the crisis has shown us that we need to have exchange of data across different member states, across different healthcare systems, not just in terms of exchange of data about epidemiological situation, but also in terms of European reference networks, in terms of getting second opinion for medical professionals, for patients who cannot travel to other member states. So we need this common system of exchange of data, also to conduct clinical trials, where some member states are not included in clinical trials because of smaller number of patients, for instance, in smaller member states. So if you want to have this common European system, if you want to have exchange of data, if you want to have functioning European reference networks, if you want to have clinical trials which are organized across the European Union, we need to also have the free flow of data, which need to be interoperable. And this interoperability is essential because currently we have different rules across different member states, different standards and different protocols about the use of data in different member states. This is something that needs to be harmonized. And I hope that the new legislation that is being talked about in Brussels will come as soon as possible so that we can have this system. So to have interoperability of data, but on the other hand, obviously also respecting all of the reasons and all of the requirements related to protection of privacy and personal data. But I think this balance can be achieved in terms of health data on EU level. So to sum up, I think that European Union, despite this division of competences, has a lot of possibility with its current powers to act. I think that the crisis has shown us that we need a common European approach, more coordination, more common procedures to address problems which arise during crises like this. We also need more investments to make healthcare systems more equitable across the European Union. And I think that with the current powers and the current budgetary possibilities that exist in European level, European Union can really help healthcare systems to be more resilient in the long term. So thank you very much.
Thank you very much indeed. You've certainly rapidly run through quite a lot of major points there. So thank you for that. A great way to set the scene for our discussion. Now, as I promised, we're going to hear about this manifesto, and we're going to hear about the coming up discussions on the future of Europe, because former Commissioner Vytenis Andriukaitis is also the head of the Lithuanian delegation to the conference. So I'm going to hand over the floor to you now, sir. Tell us about this manifesto and what you expect to be the outcomes from the future of Europe discussions.
Thank you very much indeed. Good morning, everybody. I'm very happy to be with you today. We are celebrating the 15th European Patients' Rights Day, and very important time. COVID-19 is an awakening call for many. In 2021 has been designated by WHO as International Year of Health and Care Workers in appreciation and gratitude for their unwavering dedication in the fight against pandemic. World Health Day this year was dedicated to equity, keeping in mind access of all people to vaccination. The Portuguese presidency of the Council of the EU on 7th and 8th of May will organize a social summit with the aim to endorse the action plan of the European Pillar of Social Rights. And I'm happy that we in the Commission include healthcare into social pillar. You can see the 16th point, healthcare, about everyone has the right to timely access to affordable, preventive, and curative healthcare of good quality. And now access to timely healthcare and cure will be included into action plan also, thus building still tentatively European Social Union. We see opportunity for the European Health Union to become part and parcel of it. And of course, on the 9th of May, we will see, opening of the platform, the conference on Europe, and the conference on the future of Europe will start. And on 21st May in Rome, the European Commission, in cooperation with the Italian G20 presidency, will co-host the Global Health Summit. In front of those events, civic society and patient advocacy groups' voice is needed and to be heard as never before. Civic society and patient advocacy groups are demanding stronger health policy and more coordinated action for health. Diseases do not care about borders, and their management should cross the borders too. In front of COVID-19 pandemic, nobody is safe until everyone is safe. Is a lesson learned by all of us. We have to care about everyone's lives, and not just in the EU. We are at least more than 1 billion people living in the European WHO region, and today, like never before, a call to action made by Pan-European Commission on Health and Sustainable Development, chaired by former Prime Minister of Italy, Mario Monti, to rethink broad health policy priorities, to step up investment and reforms in health and social care systems, keeping in mind universal health coverage, is especially important. Healthcare workforce shortages are ingrained common problem for many countries. In many regions within and between countries, we can see lack of nurses and doctors. Medical deserts undermine people's trust in our promise to leave no one behind. Some researchers looked for clues why excess deaths differ across the EU member states in 2020. And an increase of deaths, you can see in this slide, an increase of deaths in 2020 was compared with a number of hospital beds, doctors, and total healthcare personnel employed in the sector of human health. Correlation between total employment in the health sector and excess mortality appear to be strongest. Increased public investment in the health sector is needed in all countries to make progress towards universal health coverage and to improve people's health care. And it is a very important goal for all patient advocacy groups to ask political leaders at all levels to treat the health care sector as a vitally important, productive sector of our economy. Health could be the most dynamic driver for the achievement of a social Europe. Health and well-being are two faces of the same coin of social Europe. International cooperation of the universal health coverage is very important in our fight against NCDs, cancer, rare diseases. No one country alone, please keep it in mind, no one country alone can treat patients with rare cancers and rare diseases. Very timely initiative. Europe's Beating Cancer Plan is in line with our obligation, leaving no one behind, can be the most promising field of pan-European cooperation in beating cancer. And it can show a leading example of global cooperation in this field. Another area, rare diseases. Rare diseases are affecting up to 30 million in European region. And here we see efforts to cooperate at EU level, but on voluntary basis, treating those patients through European reference networks. But as national rare disease policies and national cancer plans are not harmonized and equally prioritized across member states, rare disease and cancer patients are still subject to postcode lotteries, and their outcome bears still hugely dependent dependent on the place of birth and residency. And here we need to have shared competencies between EU and member states while preserving subsidiarity as a core principle. As you know, in food safety, we have shared competencies. In public health, in some small areas we have, but in health care we didn't. And we need the European Health Insurance Fund to cover rare cancers and rare diseases, but we don't have to do it. A record-breaking speed of vaccines development shows potential of international cooperation to develop life-saving medical technologies. More generous public support for fundamental research is needed to provide help to millions of patients that need innovative treatment. Accessibility to life-saving technologies and to innovative treatment is a right, fundamental right of all patients. Patients in Portugal, Germany, Lithuania, Italy, or anywhere deserve to have equal access to innovative treatment and to be treated equally according to the same medical protocols. Our EU is unequal and unequal one, speaking about access to health care and cure. This is not only unfair, but it is preventable, and only the European Health Union can prevent it. If we all thinking about leaving no one behind, health in all policies, patient-centered approach, we need to have a strong, genuine European Health Union, which must be enshrined in Lisbon Treaty. Europeans clearly articulate their priorities. Please look at the next slide. According to the Eurobarometer, in summer 2020, health appeared to be the fourth most important issue facing the EU. In winter 2021, health is leading the list with 38% of Europeans indicating health as a first or a second most important issue facing EU. And it is very important in front of conference on the future of Europe. European leaders today are much more sensitive to demands of patients than 2 years ago. In this slide, you see dynamic. Year 2017, European Commission white paper on the future of Europe didn't mention health. In early spring 2020, only few dreamers dared to call for the strongest representation of health in European treaties. Then European Parliament started to discuss those issues. In September 2020, European Commission President Ursula von der Leyen called for European Health Union. October 2020 was Manifesto for European Health Union and Explanatory Memorandum. In April 2021, German Chancellor Angela Merkel indicated that she does not rule out a treaty change, keeping in mind debates about European Health Union in the conference on the future of Europe. We all know a lot of unions: customs union, economic and monetary union, banking union, and digital union, so on and so on. Some of them are enshrined in Lisbon Treaty. Some derive from it as part of internal market. And it is very important from legal point of view. The aim and core means objectives to the EU are enforced by the Article 3 of the Treaty on European Union. Thus, health is not on the Article 3 of the Treaty on EU. And human health is out of shared competences between member states and in EU. Only common safety concerns in public health matters as shared competence between member states and EU. Being Commissioner for Health and Food Safety, I had a very strong tools in area of food safety because of single market, but I didn't have the same strong tools in area of public health and health care. Only cooperation, coordination, supplementation, but member states do not have big appetite to cooperate. Such constitutional asymmetry, which is enshrined in Lisbon Treaty, and legal limits enshrined in treaty, remain unchanged till now. European Union is just at the very beginning of transforming itself into European Health Union. Political debates on the first building blocks of the Health Union just continue, concentrating on what can be done with existing legal, financial framework, instruments, or fine-tuning of existing instruments in parallel to develop new secondary legislation. But it is not enough when we are speaking about strong European Union. We need more. Tradition to ignore health as a topic of European policy till now is strong across national governments and European institutions. The EU does not take actions prevail unless it is more effective than action taken at national level. It is mantra from all legal services of three institutions. Voices of patients are much more fragmented in comparison to those lobbying for common agriculture or other traditional EU policies. It is time to consolidate civil society and patient advocacy groups, forces in our desire to build a genuine European Health Union. The European Health Union is a new chapter in the development of the European project, the chapter that should be written by all of us. Let us disseminate manifesto of European Union. We need million signatures. Now we have more than 1,000. Patient advocacy groups, patient organizations. Let's do it. It's time to act. Let us talk for more healthier phase of European Treaty on European platform devoted to the conference of Europe. Europe is not just internal market per se. Let us challenge our national parliaments and governments. Yesterday was very excellent idea. Nothing for us without us. Lobna Salem mentioned this idea. Our voice must be heard. Let us work with academia, public bodies, industry on design and advocacy of pan-European policies that provide more health for Europe and net present value of member states of Europe. We need more European health, and we need more health in Europe. Green Deal is is on the EU agenda. We need to add health and well-being deal. Let us amend Part 3 of Article 3 of the Treaty on EU, which starts with the Union shall establish an internal market and so on, with one additional sentence. Last sentence, it would be, it shall promote universal health coverage by establishing a health union. It can build a genuine European health union, and it can change immediately situation, speaking in the future about possibilities to strengthen EU and to have genuine European health union. Thank you very much indeed. And here you see manifesto and where you can find it.
Thank you very much indeed for presenting that manifesto. There's a lot to get through, but I'm glad you were able to present that along with the slides as well. So we're going to turn now to the other document I mentioned, which is the Citizens and Patients Recommendations. And that, as I said, has been signed by 29 associations. And the starting point of this is they're simply not acceptable to respond to the immediate needs of citizens and patients facing the COVID-19 pandemic simply by closing services. There's a lot more concrete proposals in this document, but I'm going to hand over to explain a little bit more about it, giving the floor to Paola Testori-Coghi, who is chair of the T20 Task Force for Global Health and COVID-19 and the special advisor, and of course reminding us all again that coming up at the end of this month, the 21st of May, they will hear about the Global Health Summit, and we will hear more about that. So Paola, I will hand over the floor now to you. Looking forward to hearing your comments.
Thank you very much. After the really great intervention of Commissioner, Andriukaitis, I will continue to say what the Italian presidency aim to do and what will be, the great events which we will have this year. Because clearly the pandemic can be and must be the catalyst of a fundamental modification of mechanism and structure for the prevention and the response. And these changes will have to be implemented at local, national, regional, and international level, because we have seen we live in an interconnected, interdependent world, which need, public health policies more coordinated and more integrated. As I said, there will be a series of events and a series of forums of discussion which will happen this year. The first will be the Global Health Summit, which Italy will host in Rome in May, 21st of May, and will be the first occasion for the leaders of the G20 and also the international and regional health organization to discuss how we should improve the present system. What should we do to strengthen our health system? And the discussion will concentrate on three areas. First, effective cooperation. Second, health system. Third, resources. On the effective cooperation, the most important issue on effective cooperation is what MEPs Sokol mentioned, the exchange of data, because we have seen in the present emergency that the alert system did not work. The present alert system, not only for new pathogens, but also for existing pathogens, of very important for resistant new existing pathogens, are inadequate and are too slow to respond. But why? Because they are incomplete, they are fragmented, and they are influenced by politics. We have seen they are influenced by politics. So we need, to set up a system which will enable to share information among scientists more rapidly and to analyze this information always on based on a One Health approach. Because, usually all the problems arrive at the interface of human, animal, environment, and we are affecting a lot, this interface. And you know that the G7, for example, has already discussed the setting up of a new One Health Intelligent Hub. And also the WHO is considering a new global surveillance infrastructures for COVID-19 and beyond. So internationally, we have realized that we need to have a better exchange of information and a better, rapid alert. And when I speak of exchange of information, I also refer to epidemiological surveillance. So to have a better epidemiological surveillance will enable countries to identify a population which are vulnerable to infection and will improve the intervention. Because we have seen in the COVID-19 that there has been a lot of existing weaknesses across and within society, which we were not able to detect. So we need, a new epidemiological surveillance, which will, include data on, testing cases, death, hospitalization, vaccination, case rates in health workers, but all according to harmonized protocols and also, disaggregated by sex and age. Second issues on which, the Global Health Summit will concentrate is the health system. Unfortunately, health systems, the organizational models and the response capacity which we have now were not adapted to cure the huge number of patients, and were not also adapted, and this is even more serious, to guarantee the continuity of treatment for all the chronic diseases, and also the normal activities of disease prevention for all the other citizens. So, and this will have a huge impact. And why this has happened? This has happened because over the last decades, we have seen the transformation toward what we call a hospital-centric healthcare model. And we have seen the territorial medicine reduced to a minimum, diminishing the key role of local doctor and ambulatories. So the Western world, and we are guilty, has systematically underestimated the risk of a serious pandemic, thinking that infectious diseases were for the developing world. And we have focused, very well, very efficiently, on cancer, cardiovascular disease, neurodegenerative pathologies, increasing the high efficient medium to large hospital. Clearly, such hospitals do, spend and use resources and give treatment in a very efficient way, but this approach is not effective in case of a widespread infectious diseases. So we need to reorganize our health system, leaving hospital to play an important role as, care centers, but we need also to allow patients to be assisted closer to home by family doctors and local ambulatories. Third issues on which, the local the Global Health Summit will work is resources. And this is a difficult issue. So how we can mobilize domestic resources for the Western world, but also how can we help, a transfer of resources, for the other part of the world, which will not be able, to implement the changes which I said. Then the other occasion will be the World Health Assembly, which will take place at the end of May. And there will be a discussion probably of a new treaty for pandemic preparedness and response. And the Assembly will probably agree on a mandate by adopting, a standalone decision, which will in fact give the mandate to negotiate the treaty. So this is for the future. And this is how, how Vytenis Andriukaitis said, we need a change of the treaty. But let's not forget that we have already on the table, a proposal by the Commission to change existing rule. And now, which is already something. And now it is the turn of the member state to demonstrate that it is useless to hide behind the national sovereignty issues, and that they are ready to transform, the proposal of the Commission in legally binding rules and structures, because only if unified and determined, we can win against emergency. And I want to mention one thing: the scientific world, not the political world, the scientific world has already taught us what does it mean to work unified. They are working unified. They have worked unified for the vaccine. And do you know that they are working now unified for the surveillance of the pathogen evolution and the global transmission? Because there is a database which is shared internationally, which monitor on a real time all the sequences of the virus. Do you know how many sequences of the virus there are? There are more than 1 million. There is not only the Indian variant. There are more than 1 million sequences which are now reported in this database. So let's hope that politics, will follow the example of science. So in conclusion, COVID-19 has demonstrated that the health of the entire world population can be seriously jeopardized by one single event occurring in one single place. So the responsibility for protecting global health lies on every country, everyone. Global health security is a shared responsibility and needs global solution. Thank you very much.
Thank you, Paola, for that and for that great presentation. We really appreciate it, and I know you'll be staying with us for the discussion part of our event today. So we are now on to the round table section, and I see we've got some questions coming in already, so we will try and work those into the discussion. As I said, we have some great high-level speakers, and I will introduce them one by one, and then we'll hear a brief introduction from each of them before getting into the nitty-gritty of what I'm sure everyone wants to discuss today, and that's the questions. So let me start by saying hello to Pascal Garel, who's the Chief Executive at the European Hospital and Healthcare Federation. We also have Paul de Rev, who is the Secretary General of the European Federation of the Nurses Associations. Neda Milevska-Kostova is the Vice Chair at the International Alliance of Patients Organizations. Marco Annoni is the Coordinator of the Ethics Committee at the Fondazione Umberto Veronesi and researcher at the Interdepartmental Center for Research, Ethics and Integrity. Doreen Castrati is Head of Global Scientific Affairs at Boehringer, and also Roberto Faciencani is the Executive Board Member at the European Society of Trauma and Emergency Surgery. I've got quite a mouthful to get through there, so I hope I introduced everybody fairly with their titles. Let's start with a brief round of introductions, a brief hello. Pascal, I will give the floor to you first.
Thanks a lot, Jennifer. Thanks a lot to ACN for the invitation. It's always a pleasure. I was at the first event organized by ACN, which was actually in a very symbolic city of Gorica, on the border of two countries, Slovenia and Italy. And our organization, in a few words, has always been very proactive in this topic. Early in 1979, we were the first organization to produce a hospital charter for patient rights. So it's very nice that the ball has been rolling on this issue. A few words about the organization. We were, and we're still a mirror of the diversity of a European healthcare system and health system. Actually, we were very hospital-centric at the origin in 1966 when we were created actually in Rome. But throughout the enlargements, we became less hospital-centric. We are now hospital and healthcare services, but we also cover more than healthcare, the social sector. So we are very, very much focusing on the integration of care and the need also to look beyond the care, meaning healthcare, with more involvement on social care and long-term care. So that's in a few words the introduction about the organization, and happy to continue the discussion with the panelists.
Super, thank you. Paul, over to you now. Give us your opening thoughts. You're on mute.
I see this now. Thank you so much, Jennifer. First of all, Mariano, Bianca and Daniela, grazie per tutti. I think you're doing, as a small NGO, a bellissimo job, I think. This show is civil society. With almost no means, we can move mountains. And that is what we are supposed to do. I'm also very grateful that Paola and Andrea Kakus are with us, because you are two people who know the political games of everything. You have been with your 2 feet on the floor. And this is what civil society is sometimes missing. You know, that transparency. Who are the political game players? Who is against something? And where can you use civil society to push an idea forward? And we are all in the same boat. And let me go back to when the COVID-19 started. Several cabinet members of the coordination team phoned me and they said, Paul, we are in troubles in the north of Italy. We have very bad numbers. Nurses are dying, doctors are dying, and we are in troubles. Can you help us? And my answer was, I cannot. Because none of the member states, not the UK, not Ireland, nobody had 10 nurses to send to the north of Italy. Nobody. Everybody was in trouble. The water was above the nose everywhere. And this is something the HERA needs to address now. So I'm coming to preparedness. I'm coming to resilience. 30% of our nurses left the profession in the last 1.5 years. 30%. Nurses are mainly women. Can you imagine that you are a nurse, you come home, you have a family to run, everybody is scared that you're coming home. I remember people in Malta saying, families, please stay in the hospital, sleep in the hospital, but don't come home. Stigmatization increased enormously. So I'm very happy that DG Santé is doing on Monday the mental health and the well-being of it. Because our nurses left the profession because the health and the well-being is a pure nightmare. It's a pure nightmare. And so if we want to be prepared for whatever crisis comes to us, we need to have, and this is nothing new, DG Santé made long time ago, Katja made long time ago, a kind of simulation that they said we need 1 million. God, oh my God, today we need way much more. So the problem comes more and more and more. EFN entered in the European Parliament, and it's nice to see the MEP here, in 2008, a kind of manifesto to do something about the workforce, the nursing workforce, and do it now, 2008. And we are 2021, and nothing changed. Let us be honest, nothing changed. I don't have more nurses. I don't have more physicians. But what we have, and I want to end like that, Jennifer, what we have is a lot of courage. What we have is a lot of enthusiasm. What we have is energy to stay and to move on and to help everybody that we can. And that is the good spirit that we have. But we want the EU leaders to support the nursing profession. Don't leave us behind. Don't do that. So I hand over back to you, Jennifer.
Thank you, Paul. I think you've made your point really forcefully, really clearly. I must say, when you mentioned that 30% figure to me before, I was really quite shocked. It is an alarming figure. And, you know, perhaps if there is some silver lining to come out of the pandemic, it is more appreciation for our healthcare workers. But now let's get the perspective from the patients' representatives. Neda, over to you for your opening comments.
Thank you, dear Jennifer. And first of all, great thanks to ACN, to Mariano, Daniela, and Bianca, and everyone else behind the scenes that we cannot see for inviting us, because we really appreciate every possibility to be able to share the patients' perspectives. I cannot express our gratitude also to Paula and Dr. Andriakis for their support, because any system really exists and it's there for patients. And for us, as an alliance of over 300 patient organizations in more than 70 countries, this is really music to our ears, and we are here to really offer all of our expertise and offer all of our outreach on the ground to be able to help, first of all, support the manifesto as one step, but secondly, to really closely work with the health systems, because we believe that the power that the expert patients especially have can help build sustainable health systems, because we will never be able to outnumber patients with any workforce, no matter how many doctors or nurses we train. On one hand side, on the other hand side, it is really a responsibility as well of the patients to be able to take care of themselves, of their health, of their loved ones, and in that sense to help build a sustainable health systems in which the resources, and as mentioned by Paola, can be used more wisely and more nobly to address the needs of as many patients as possible. So I would stop here. I would just also once again want to echo what Paul said about the civil society having to play a bigger role, and we hope to be able to contribute. Over to you, Jennifer.
Thank you. Yes, I'm going to hand it straight on to our next speaker then. Marco, you're going to talk to us about ethics in a broad sense. So please, the floor is yours.
Thank you very much. Thank you very much for your kind invitation. It's always a pleasure and an honor to collaborate with Cittadinanza Attiva. From the point of view of Fondazione Umberto Veronesi, we have already the pleasure in the past to collaborate for another manifesto for the elimination of papillomavirus-related cancers, and today to support this manifesto. Indeed, when we talk about ethics, the crisis has revealed both the strength and many fragilities of our system. But this signaled the need of strengthening our system and to make them way more resilient. However, the required resilience has to be built, I think, at multiple levels, as the manifesto clearly articulates and strongly demands. To this, I would like to stress the importance of including also in our shared vision for the future, the importance of what I call ethical preparedness, which in my opinion is a key component of the future resilience of healthcare system. By this term, substantially, I mean the capacity of a system to anticipate, confront, and overcome, and possibly solve ethically difficult scenarios. And indeed, during the last month, we have seen many of these ethically problematic scenarios and dilemmas, from the shortage of medical supplies to the priority criteria for admission and discharge in intensive care units, from the ethical rules for clinical trials to test the vaccines, to the questions of whether and under which conditions vaccinations may be mandatory, from the support that we owe to healthcare workers to our moral obligations towards less developed countries and fragile communities. So most of these critical challenges, in my opinion, have been met obviously in the condition of daring emergency, sometimes in suboptimal ways and unfortunately with suboptimal outcomes. An example, for example, is the need for healthcare professionals to rely and to have well-crafted ethical and clinical guidelines to manage admission and discharge in intensive care units in extraordinary situations, like for example in the pandemic. And initially this has been really a great emergency in northern Italy, as Paul was mentioning before. So today, fortunately, we have come a long way, and a new discussion has begun within and outside academia on all these morally important issues, fostering a series of results that are already trickling down in practice and leading to the adoption of better guidelines and best practices that are already making our systems, I believe, way more resilient than before. But we have to do more, obviously. We have to reach out beyond the circles of policymakers and experts, and we have to take on board and extend the discussion about the manifesto and ethical preparedness of our healthcare system also to the public and civil society. To do this, in conclusion, we need more investment, for sure, as has been already mentioned, and more discussion, as well as a new vision. So I think that the manifesto represents an important step in these directions, and therefore we are more than happy to contribute. Thanks to you, Jennifer.
Thank you. Thank you very much for that. I'm sure we will get into some more discussions about those particular areas you've mentioned in due course. But now I will hear from Dorad, who's giving us the pharma background perspective.
Jennifer, good morning to you, but also to Mariano from Cittadinanza Attiva. Many, many thanks for the invitation. It's a great pleasure and a great honor to participate in this event today. We have heard excellent speeches and discussions from our esteemed colleagues today, but I must say we also have a wonderful audience who is really motivating us to show our best, I would say. I had the opportunity today even to wear a suit. Thank you also for that. Like many other colleagues, I've also been working from home for the past year, and I think this is one of those opportunities when you start thinking of the heavy toll that COVID-19 has been taking on all of us. And unfortunately, this goes far beyond just a lack of opportunity to wear a suit or to be working from home. And during all this time, all our thoughts, all our prayers are and will continue to be with those people and with those families who have been impacted and maybe also have lost loved ones by this cruel disease. But because of COVID, we are here today because we must not forget also the non-COVID patients. Those patients, those people who are living with chronic diseases and who have now also less access to healthcare, less access to consultations. I was looking at some statistics a few times ago, and just not to talk about percentages, just to bring the statistics into our daily life. I would call to all participants here to think about their families, their circles of relatives and friends. If you would think of 10 people, and imagine this 10 people will start living with a chronic disease. Now, 3 of those 10 would not receive treatment for a newly diagnosed condition. 2 of them would not even go to a hospital for an emergency. So I think these are very alarming numbers that calls upon all of us for action. Today I'm happy to be representing Boehringer Ingelheim. We are one of the leading research-driven pharma companies. We employ 50,000 people worldwide, and all of them are really working hard to develop those kind of therapies that really make a difference in people's lives. My own specialty is diabetes and cardiovascular disease. And here I would like to focus also the discussion, or my part of the discussion today. Happy to share some experiences, some thoughts on what we can jointly do in order to improve patients' access to the appropriate therapies during these difficult times.
Thank you very much. Well, I'm having a look at some of the questions that we've seen coming in already. And of course, we've got a lot that we want to cover today, from talking about how there can be better cooperation from EU level, how we can get a multi-stakeholder approach, and so on. But first of the questions that come in, I noticed there, it's from Maria Teresa Flora Lima, asking about data. She said, yesterday there was a great talk about data, and do you think it should be possible that all countries register data in the same ways with the same programs and technology? Now, added to that, I see also a question from Cheryl Kues, who is saying that the right to information is important, but how can patients who live in a country where personal medical info is not part of the data collection access this important health information? And I think what those two have in common is that they're leaning towards the discussion about digitalization and modernization with technologies of our healthcare systems. So I'd like to get from you all your position and your attitude to about the future technologies that may be part of the solution before we get into the different stakeholders and positions on them. So let me talk, Nida, perhaps I will come to you first, because I know you mentioned data and healthcare as something that must be central to patient-centric digitalization of healthcare. So let's start there.
Thank you very much, Jennifer. Yes, indeed, the human interaction, the interaction between the patient and the healthcare system, or the patient and the healthcare provider, is critical. And digital transformation is really, can be coming in handy for improving some of the bottlenecks in the healthcare systems. However, we have been surveying experiences of patients and found out that in their opinion, the digital transformation is supposed to be a tool and not an end goal, in the sense that digital transformation is an aid that we can use to, as Paula mentioned, to exchange data or to have a better epidemiological picture of what is happening, or how we can use the evidence for making a better policy. But on the other hand side, digital transformation can also, or digitalization of healthcare systems, can help us to reduce errors happening because of the human overburden. We heard from Paul that the healthcare professionals, healthcare workforce, are just overwhelmed, not only from COVID, but even before, and non-COVID patients mentioned by Doreen. So in this sense, one of the solutions is the digitalization or the digital transformation. Exchange of data is absolutely not even the future, it's the presence that we live in and we have to face and we have to embrace. But on the other hand side, we should not really forget that the interaction needs to remain intact as much as possible, and to provide more space for the humans of the healthcare systems, which are the healthcare providers, to be able to communicate with the humans that are citizens and patients in providing a better healthcare.
Thank you, Neda. I realized I didn't give the floor to Roberto for his opening remark. I'm so sorry, Roberto. I apologize. You're on the second line of my screen and I didn't see you. Really apologize for that, because of course we do want to hear Roberto, and trauma and emergency surgery is obviously a big part of the discussion as well.
Thank you, Jennifer. I forgive you. Don't worry. I know that it's always difficult to keep track of all the people on the screen. Thank you very much, because you spelled my difficult family name very well before. So now this is a way to forgive you. Thank you to ACN for the invitation, to all the speaker here, because I heard very interesting position about actually what eventually I am really interested to know today. And thank you also for the attendance that is very huge. I'm happy to see many people around so interested in this topic. As you said, I'm an emergency surgeon by medical background. Actually, it was my field of interest since a couple of months ago, where I moved to become head of an emergency department. So right now I'm more dealing with emergency medicine instead of emergency surgery. But I'm here on behalf of the European Society of Trauma and Emergency Surgery, that actually is the largest network of expert and practitioner dealing with trauma and emergency surgery. I'm a board member, and actually it's very interesting because a few days ago we celebrate the annual Congress, web-based, obviously this year. My speech was eventually on this topic: was Lombardy region a poor resource environment because of the COVID-19 pandemic? And I mean, I find in what has been said already a lot of topics that are rise up during my presentation. So the richest and one of the most known region in Europe, with an health system that is presumed to be the best one in Italy and one of the best in Europe, was really, really in difficulties in the first month of last year because of the COVID-19. So what did happen to transform one of the best health systems in Europe in such a poor environment reality? What was the reason? And I'm interested to challenge the other speaker on this. What is the reason why we spoil our health system so much that a pandemic, of course, this is a huge event, an unexpected event, but why, as Paula said, we didn't, we were not able to understand that such a scenario was not so remote, and we didn't prepare for it. Actually, we did the opposite.
Okay, thank you very much, Roberto. That's a strong question to put. I'm going to come back onto this point that we had just been discussing about digitalization, because this is one of the 10 recommendations in that document, which is to support the digital healthcare transition. Pascal, we heard from Neda there on the patient view. What's your perspective?
Thanks a lot. There are different levels here. If we take the European one, there's, European Union one, we have two pieces of legislation now. Well, one is coming and there's a consultation on it. It's the European Health Data Space. And that's clearly something dealing with this issue, and invite all the participants to share their views, as we will, on this topic. And the second one is also important. It's the artificial intelligence. And here we have a proposal of the Commission. That's one level. And the COVID has shown that we are very poor in data quality today in Europe. If you just take the basic and important data element of mortality, we understood that it was not possible to be clearly having a vision of the different levels of mortality in Europe. And there are works going on. They were before, but it's going on. So that's one point at European level. Ourselves, we have been more working at, let's say, the micro level, and we have organized one webinar, and we organized another one in June about the data exchanges. And actually, with or without digitalization, there are still countries on pen and paper culture. So we were interested in how does the information circulate in this time, not only within a hospital, not only within the healthcare sector, but also with the long-term care sector, the social sector, the home care, and so on. And here we see also a huge diversity of approaches in Europe, and that explains also a lot of mishappening in the organization in some countries. And I don't want to answer Roberto, but I would advise Roberto to get the answer in the international press, or just asking your Veneto region colleagues why they had a different situation. And there are interesting things going on. And I don't want to elaborate on this. Digitalization, it's there. Again, at different level. When we talked, and Mr. Sokol was there, is still there. When we had to put in place the Falsified Medicine Directive, we discovered that our Croatian colleagues were unable in the pharmacy of hospitals to do with it. because our broadband was really bad. So digitalization is also technology. Last point I want to raise is the message we heard also from professionals, and Paul is very involved also in this issue of digitalization, is it may create even more pressure on professionals. And it has created more pressure on professionals. And artificial intelligence may even be worse because of the responsibility it gives to professionals, doctors, and nurses. They will be involved in artificial intelligence. So we have, again, to be carefully look at this proposal of the Commission from the angle of patients, professionals, us, organizations, providers of care.
Paul, I'll let you chime in on that. I can see you're nodding and have a point to make.
I always forget to unmute myself. Anyway, I fully endorse what Pascal just comes to say. Let me give a practical example. I came into nursing in 1984, and 45% of my full time went to direct patient care. So washing patients, giving food, doing the work that you do with the patient as a nurse. Today, we are not at 30%. So that means everybody is asking, can you collect data? Can you collect data? Can you collect data? Everybody, equally for the physicians. So what we are doing is drawing our nurses and our doctors to projects, to separate rooms, except patient care. And this needs to change. I am in favor of data collection. I am in huge favor of artificial intelligence for clinical pathways on one condition, that it lowers down the workload of the nurses and the doctors, and that it keeps the nurses and the doctors there where we need to be. And that is, and it's possible. And that's why co-creation with the industry, co-creation with the developers is key, because we are talking two different languages. We are getting apps, we are getting God knows what, we just don't have the time. And that is speaking from a nursing perspective, daily frontline nurse. And that is perhaps the colleague from Italy, perhaps something that went wrong. What is the role of nurses in Italy? What is the role, the capacity to run the system in Italy and in other member states? We are still far away from where we are, where the US is. We are still far away. We have nursing-led clinics in the US. We have advanced nurse practitioners starting in Europe. All these models will have an impact on the health systems. But all comes down to good data collection. And I'm referring to the ILO. ILO is reviewing the categories of who is a nurse and who is not a nurse. So the data we got up till now from WHO, from Eurostat, from ILO are not correct. They are totally biased. So we are making policy decisions on wrong data, and that needs to change. That needs to change.
I think absolutely we hear this in the data discussion all the time, which is, garbage in, garbage out. The quality of the data is obviously hugely important. Mr. Andriukaitis, Vytenis, I see you were giving a thumbs up to Paul there. Did you want to add a comment?
Yes, I fully agree with what just Paul de Reve said, absolutely. I see a big gap between developers and reality in hospital. I spent in hospital 27 years. I started with a nurse, and then I was general practitioner, and then I was cardiac surgeon. I know very well environment in hospital. But if you look at developers, IT and so on, It's silo mentality. Once again, silo mentality. We need to understand that if you wish to something to develop, you need to be on the field, concretely on the field, to know reality. Because really, when we are speaking about leaving no one behind, it's shame because you see a lot of around us leaving behind. Because, you know, what can you do with people who are underground, for example, or 50 million people in poverty in the EU? Are we capable to think about their health situation and status? Why? Because social and care and healthcare system are so, they were so fragmented. And when we are using word system, I see only in few countries systematic approach between primary care, secondary care, and system need what? Digitalization of system, but keeping in mind concrete field, concrete piloting of areas. I can't, you know, I am very happy about those debates, and of course also pressing on the collection of data. Data is brilliant tool, but we need to have, you know, how to say, some clusters where we can really, you know, have experience how we are collecting. Look at European reference networks. European reference now are joined more than 300 universities, more than 1,000 units across EU. But how it is difficult to introduce interoperability, data exchange, you know, because they are not supported from EU level and from member states level. Cooperation between member states and EU is so weak. I saw a question which was addressed to me from Pernilla Günther. Today, here is no follow-up of recommendation and national guidelines. Yes, you are right, Pernilla. If you look at the situation in every member state, you can see jungles between different guidelines, protocols, and so on. And it's a simple example: national vaccination calendars. What the measles outbreak was. Now we have COVID. Yeah, can we understand situation? Can we harmonize our national vaccination calendars in all 27 member states? Because it's urgent situation. We need to urgently exchange about our vaccination to our children or vaccination of our people today in front of COVID. But you know, we need to understand very practical issues of cooperation. And my answer is very clear. Please keep in mind that only we need to really think about changes in the treaties. Otherwise, we have no chance to encourage member states to do steps in more harmonized way. Doesn't matter data collection or cross-border health care or so on and so on. Can you imagine that in half a year you can see only one formal meeting of health ministers at EU level and one informal? Agricultural ministers are gathering every month. Health ministers only one per half a year. And why? Because agriculture is shared competence. Labor market is common, shared competence. And healthcare is nothing. And it's so weak, I can't imagine how can I explain. But now it's time to think that we need to discuss new possibilities to improve Lisbon Treaty. Otherwise, you have no chance to encourage member states to understand that they need to share data, responsibility, care, QA, and so on and so on. Please look, as I can show you this card. You know, it is very important card. It's you know, it's Lithuanian one. It is a social insurance card, which is connected with my health insurance. Are we, you know, ready to have pan-European card and to understand that we need to do something in more harmonized ways? That is a question.
Thank you. I hear very passionate voices, and I know this is of huge interest as well to our audience. I will mention, actually, just recently we have seen the European Health Data Space. The European Commission has just opened a public consultation on that. So you have until the 26th of July to respond to that public consultation if you want. Paola, I see you're raising your hand.
Yes. I would like to ask a direct question to Vytenis. I agree with you that we need a change of the treaty. If we really want to change the setting of European Union, we must change the treaty. But we know that the change of the treaty will take, 4 years, 5 years, And then when you start, with the present political situation of Europe, a change of the treaty is also risky. So don't you think that we should also create, as NGO and as a public society, representative, a strong pressure for the member state to adopt the proposals which are on the table very quickly, because this proposal of a regulation could be adopted, if Parliament and Council agree. We have seen with the Green Digital Certificate that they can agree in 6 months. So if they can agree, in 6 months, we can have legally binding rules which will improve the situation. So let's go on 2 parallel tracks. Change of the treaty, but also pushing for the member state to change, the legal rules now.
Okay. I fully agree with you, Paula. We can see both ways together. Now it's time to press very much member states to do their homework, especially speaking about legal responsibility. Please look at the health technology assessment proposal. We proposed it in 2017. Till now, no progress. Why? Because some member states are blocking situation. And if you please keep in mind how long what issue related to cross-border healthcare implementation. I spent 5 years pushing member states to do more. Started with some infringement procedures and so on. You know, Paola, very well. But at member states level, they have no chance to do something because it is not in the treaties. Please look, food safety issues. You have absolutely different way. Then every month, every year, every minute, the member state will react immediately. Why? Because it shares responsibility and Commission has very strong tools. Now we need very strong tools in our hands, speaking about healthcare and cure, especially in rare disease and rare cancer, when no one country can act alone. No, absolutely. It is impossible. Well, can you imagine some patients are waiting diagnosis only 9 years? Or treatment 12 years, because they have no chance to be treated in Malta or Lithuania, small countries. We see second-hand patients, and we must speak about. And yes, treaty changes can take time, but implementations of laws also can take time. Sometimes more longest. Please look at healthcare cross-border directive. Till now, we are not there. Doesn't matter that it's legally binding. Please look how many countries are implemented Council-specific European semester and specific recommendations. From 27, 6 or 9, and that's all. We need to change situation now, and people voice. Now it's time to encourage conference on the future of Europe to very much, because I hate word politicians and don't know what does it mean. Because sometimes you see, like people elected and they're politicians, but they do not understand nothing. But then we see a big gap between understanding at political level and people needs on the ground. Yes, I agree with you, Paula. We need to go in both directions, but please keep in mind, treaty changes in health. Health is very close to all people's hearts. Health is in our pockets, in our wallets, in our everyday life. And if we will ask people to support possibilities to strengthen Lisbon Treaty, they will be with us. No doubts. A lot of people.
Thank you. I sense your frustration as well with the slow pace of things, and I think people in the chat are actually saying the same things as well. We've seen that Penila Gunther also agreeing, Cheryl again saying it's time to act, Nikos Andropoulos saying it's a really good point. It's you're obviously resonating a lot with the audience. Now, Pascal, I know you had raised your hand as well, but keep it brief because I do want to come back to Marco and Roberto and Daria about financial matters. But Pascal, over to you briefly.
I fully agree with Paola. You just take the example of how the European member states saved the European banks some years ago. They did it very fast. That's clear. We organized our first European Agora in Health in 1991. 30 years ago, there was the Maastricht Treaty. So we have been in all those processes of changing of treaties. It's a risky business. It's a very risky business. So I fully agree with Paola. We should act now quickly and have the long-term view also in mind, but don't expect too much for treaties. It's risky business. You have a populistic countries now, we're gonna use it. And it's gonna be against health. The issues are at national level. Some countries don't spend enough money on healthcare and social care. We don't have the same social model, honestly. Yeah? There are some countries who spend twice much in social protection than others. That's where the issue is. So European organizations are here to help at national level and regional level.
Thank you, Pascal. I think we'll not get into the dangers of treaty change in general as a pan-European general issue, because we'd be here all day. But you have mentioned about spending, and these are some of the points that are the recommendations in this document that we were talking about that Paola presented earlier. One of them is to secure well-resourced healthcare systems post-COVID-19. I think that goes without saying that everybody can do it. It's also suggesting one of the recommendations is a follow the money approach to monitor the funds of the recovery plan. So how we can actually get more money going to actual patient care. Marco, let me ask you what sort of financial, ethical considerations there are around funding healthcare.
Well, I think that, for example, integrity and transparency are absolutely paramount in what we will see. So it's very important to adopt a broad ethical approach in not just following the money, but also projecting how that money will be spent. I'll make an example, a concrete one, referring back to the previous question about digitalization, for example. We, together with other colleagues, recently conducted a study about the knowledge of psychotherapists and psychiatrists in professional schools about artificial intelligence and machine learning and the impact on mental health care. That we have to recognize that during the pandemics, for example, have been extensively moved online, and the issue of mental health care is definitely paramount. What we have found is that basically they estimated that they spent less than 1% of their curriculum at the university studying those issues and preparing to adopt those new tools. So this would represent one way of looking forward on how to spend wisely the money. So to prepare and change and revise the curricula, for example, of scientists and healthcare professionals in order to adjust for the future to come. That is already here, the future of digitalization, artificial intelligence, and so on. And also I will follow up on the previous comments. So we really have to think systematically how much money we want to dedicate to a critical issue that is the one of health and well-being in our future society in EU. Probably we don't spend as much as we ought to, and I would say surely in some countries, but the same goes also for science. So science has been incredibly successful during the pandemic in providing, and also the industry, concrete solutions to the crisis. But we have not to forget that there are many countries, Italy included, in which the funding for scientific and clinical research are chronically underfunded. So this would be another, I think, wise way to combine our ethical agenda, priorities, and visions together with the recovery plan, which is an absolutely critical piece of the puzzle in order to have a better European Union and a better community together with One Health.
Thank you. I see Grace Attard saying there that there's a possibility to do a search on professional educational activities with the IEEE, and one particular area they are working on is healthcare. So I think resourcing, scientific funding, and also training is probably going to come into this question of resources. Dori, let me ask you, and then I will come to Neda. What role does the pharma industry have in this? I mean, we talk about money, we talk about the speed of scientific approaches getting to patients. Tell me a bit about, I mean, the experience, I guess, of the last year and a half.
Yeah, sure. So I think we need to see also to look at the positive sides of this situation. I mean, during COVID-19 times, we see also large injections of money, governments moving in the right direction. So we have hospitals who have now received this injections of money, trying to speed up also the processes, the services, the infrastructure, workforce, and so on. On the other hand, in parallel, we see also a decrease of spend in some places due to unfortunately, due to the foregone care and the service disruptions that we have had. But this is looking at the positive side of this. This is a good condition to start in the new year with sufficient funding. I think we have had now our learnings. Healthcare systems have had their learnings. We need also to look at those situations or to look away from those situations where you define next year's budgets based on the spending that you have had this year. As I mentioned before, if you have a decreased spending this year, this doesn't mean that you need less budget in the next year. You need even more budget due to the particular situation that we have been. But if we see also increased funding, let's use also this funding and let's think about patients who suffer from chronic diseases and think about how to improve their healthcare. Now you asked also about pharma. We, from our side, we are continuing to do our homework, thinking or looking at Boehringer Ingelheim, for example. Last year, spending on research and development has been 3.7 billion euros, which has been a significant increase compared also to later years. So I think we are doing our homework and we recognize how important spending in research and development is. And COVID-19, if we are to thank COVID-19 for something, then it would be the urge that it has, or the pressure it has put on us to increase spending in research and development.
Thank you. Yes, you mentioned patients with ongoing chronic conditions. I mean, this, again, it's all coming back to, these are all in the recommendations. There's a better address patients living with a multi-comorbidity question here as well. And then there's the ongoing question of immunization, screening, diagnostics. I mean, it's not just all about responding to the current crisis. But Neda, you wanted to add something there.
Yes, I was just triggered by the discussion on the resources here, more in the sense that when we say resources, I don't really link it directly and always only to financial resources, although they are critical and very important. But there are other ways in which we can support the healthcare systems. I mean, first of all, and responding to the previous discussion a little bit on how we address it, whether through the treaty or through the parallel track, we kept saying not the civil society only, but the science and academia as well, that almost 80% of the health comes from outside of the healthcare system, because once the thing comes to the healthcare system, it's already too late. So we need to invest more in prevention, and prevention can be invested through not only in the type of screenings or preventive health services. We can be working more on the health literacy aspects, including the agriculture that was mentioned, including the promotion of the healthy lifestyles and choices, which are outside of the remit of the health sector per se. And we would be happy, and I cannot tell you how much patients actually advocate for prevention, because they have been themselves there, and they know that if it is possible to be prevented, it is better than to have someone going through the curative procedures and through the entirety of the labyrinth, also themselves not being happy by spending the resources. Another thing related to resources is, again, not financial, but rather in kind. I mentioned earlier that we might need to consider, and we might need to factor in expert patients more into the sustainable healthcare systems, without any pretense that patients should become health providers or healthcare experts, but with using their own lived experience to share with other patients that can find it very useful. We had a pilot with a couple of patients from several of our members, and up to 80 times more time is spent on personal care for the disease by the patient compared to what they get from the healthcare system. Can you imagine the richness of the experience? Can you imagine the richness of the responses and answers to the quality of life questions that all these patients have, that the healthcare system can never provide? Obviously, it's not even intended to. So if we can try to bring the voice of the patient through the expert patients, as I mentioned, without any pretense of them becoming or replacing the healthcare system, but rather offering a different outreach for those that are reliving the experience of someone else, I think that we can help the sustainability of healthcare system that can really focus on diagnosis, on providing healthcare services, and for as many people as possible.
Thank you, Neda. Roberto, I want to bring you into this question of resources and resourcing. I mean, is there a magical formula, a silver bullet that would see the right resources allocated to the right place at the right time, bearing in mind that that will shift? And you know, sometimes it may be training, sometimes it may be disaster recovery.
Thank you, Jennifer. That's very interesting. You know, right now in Italy, there is this hot topic of the use of recovery funds, and, you know, the race has started between the different party to take their piece of cake of the funds given by the European Union. Look, eventually, when you think about putting money in something, then immediately it rises up the need of innovation, digitalization. I want just to mention what Paul said. Look, when you look to the healthcare professional, you have to think to innovation, digitalization, just if they reduce the workload of these people. Otherwise, they will give more time to the PC activities instead of the care of the patient. So keep in mind this. Second point is, you know, my mentor that actually is Professor Stan Lenquist, a huge expert in disaster medicine in Europe, says to me, Roberto, look, in disaster, technology will always fail. So keep in mind to have a backup system, go back to paper instead to rely on computer and digitalization. Which investment will never fail? So this is a good question, but the answer is, of course, the investment in people. What did it fail to prevent the spending review right now to cut? The education, the training of professionals. Ask Paul. Paul, how many of your nurses right now can start their activity working beside another nurse instead to be, you know, jump in the job because you run short resources? The side training on job is not there anymore, and we cut all the training of the people to spare time, to spare resources. But this is how we will fail. We not have to look so far. We have, you know, less possibility to rely on education training. And this is where I would suggest the health authorities to put the money of these recovery funds to invest in the healthcare system.
Paul, you want to respond?
Yes, the European Commission has a key role in this, because if the recovery and resilience plans need to be submitted to the Commission, I saw all the member states already their plan. And to give an example, Belgium gets 7 billion euros. What they are very good at is saying, oh, the rule of the Commission is that 20% of that 7 billion goes to digitalization. And they have immediately plans and they have everything. And all the member states do that. So the Commission should have said also, your workforce, you need a threshold of 20% of your funds that you will get from the EU will need to get to the health workforce. because we know already yesterday or the day before there was an attack to the Belgian government and all the PCs, they dropped out. So all the vaccination centers, 19 in total, they didn't have any more their PC, nothing. What did the nurses do? They continued their work. You cannot stop doing your work in the OR or in the emergency room or if a patient is dying because a PC is not following anymore. You need to continue. And you need always a backup. Nurses have always a backup. But, Roberto, it takes 4 years education by the Directive 55 to develop a nurse. Huh? You cannot develop a nurse in 2 weeks. Huh? That means that since 2008, governments should have produced more nurses so that we would not face the problems right now. So let us not complain, but let us please prepare ourselves for the next nightmare that comes to us.
Thank you, Paul. That's a good point. Marco, I want to ask you a sort of a wrap-up question regarding, well, Paul's mentioned the next nightmare, but let's talk about what perhaps beneficial things could have come out of the pandemic, in terms of focusing the mind a bit more on healthcare.
Well, definitely we need, as we have heard before, a more systemic approach. We need to invest more in research, training, the well-being of our workforce indeed, but we also have to think differently about many other issues that are related to healthcare. For example, our relationship with the environment, which we know is absolutely key in projecting the next nightmares that we might encounter, as we have also heard in the opening remarks. We have to really rethink also the way in which we interact with other species, the way in which we, for example, invest in intensive agriculture or farming, because these are all leeways that might lead to other health crises. And again, this is a sort of problem and issues that can only be confronted at the European level and together with a coordinated and systemic approach. Unless we allow ourselves to really collaborate as we are doing in this very interesting panel, but also to translate that at the practical level and at the political level, then we had better prepare ourselves and indeed become more resilient, at least individually, because this is not the last time that we will face a crisis like the one that we had.
Thank you. Dorrit, let me also ask you a sort of similar question, sort of taking a step back, if you like, and looking at the crisis overall. I mean, there's been a big focus on COVID-19 patients. Perhaps has there been a sense that once we get over this crisis, things will return to the way they were before, rather than being a wake-up call?
Well, I think the answer is no, we will not fully return to the way we were before. I think I mentioned also before, we need also to look at the positive sides of this pandemic, one of them being the surge in funding of healthcare initiatives and in research initiatives that we have seen. Another one is a topic that we also discussed today, which is digitalization. I mean, the realization that we can move on projects also on a remote way, but also implementing new tools and exploring new possibilities. I would like to mention, for example, the possibility of conducting clinical trials also, let's say, online or through a remote setting, which is a big service to our patients. So this is what the pandemic brought us in terms of positive effects. We want to keep also for the future, and we want to exploit them also in the future. So we will continue with investment in research. We will continue also with the digitalization of science and so on. And we need here also the help from policymakers across Europe to facilitate this digitalization, also to strengthen the digital infrastructure in Europe, and to create frameworks that enables us the collection and the evaluation of data which is needed to develop therapies that patients, especially patients in chronic care, much need.
Thank you very much. I'm looking at the 10 recommendations because I want to make sure we at least touch on all of them in our discussion. So Neda, one of the ones we haven't really mentioned quite so much is the need to engage citizens to improve the healthcare system. We've talked a lot about what can be done from a regulatory point of view, what should be done in terms of financial resource. What do we need from people?
Well, actually, if we, as you said, step back, maybe one thing that we are forgetting as societies, and I'm not saying that COVID has not reminded us very harshly, but one thing that we are forgetting, I think, is that the economic development and well-being are not an end goal in itself, but they are intended for ensuring better health and well-being of the nations. Because what is a nation? How is a nation better off if it has all the wealth in the world, but then their population lives up to the age of 50, for example? So if we really try to rethink what are our values, maybe we can understand also what can be other roles of the citizens and patients in the healthcare systems. Now, when we say healthcare systems, most of the time we think about patients. Of course, as I said, once we are there, we are patients and it's already too late. The role for the citizens and patients, because citizens are both caregivers, patients, and hopefully healthy citizens, the role that they can play is they really get engaged more into in health literacy. And I think governments really need to take this point much stronger in the sense of trying to lift up the knowledge on how we can prevent, but also how we can treat. So having powerful and knowledgeable nations, I think, can help contribute to their better health and well-being. Of course, obviously not in 100% of cases. There are genetic diseases, there are other diseases that we cannot simply prevent. But there are huge possibilities and huge opportunities where citizens can learn, they can share, they can try to prevent, they can try to make healthy choices. And this is, again, it doesn't draw a straight line with the sustainability of the healthcare system. But it does at the end of the day, because alleviating the pressure from the healthcare systems, from preventable diseases, from premature diseases and so on, that can help contribute a lot to properly and appropriately using the resources. Another aspect mentioned by Paula earlier is that we still have very much hospitalized systems, if you wish, and we have sort of removed the primary healthcare importance in not only healthcare but in prevention as well. So if we try to put more emphasis on that, as a frontliners, as a first point of contact with the healthcare system that the citizens have, as a continuous care that they get from their personal doctors, from their primary care doctors, I think it can lead to also earlier detection of diseases. It can lead to prevention of complications and so on. Again, without any pretense that any citizen, without their desire, or any patient should replace the healthcare providers, but they can contribute with their observation, with their knowledge of their personal situation. They can complement with the knowledge of the healthcare provider. So this is something that we can have as citizens, as patients, as our responsibility, not only as a right to better healthcare and well-being.
Thank you very much, Neda. Now I want to go to Roberto. We're going to just a little bit about disaster medicine. You know, we've talked about one of the other recommendations is about diagnosis and screening and so on, but how do you balance that with disaster medicine? You know, we've seen up close and personal in this last year that disasters happen.
Thank you, Jen. Yes, I mean, this is very interesting. I hear a lot of terms related to disaster medicine, like resilience, like prevention, like response. But I wonder how much this COVID-19 pandemic and for the rest all the disaster event are usually managed by disaster expert, or how the medical personnel really are engaged, involved, and educated in disaster medicine. I mean, if you look to the topic, to think to any kind of event like a possible event you approach with the weapon of the disaster cycle management, of the education in the way to look into the previous events and to better prepare for the future. I really think that we will change our way to approach disasters. Look at this COVID-19. Who were the guest star of this event? Epidemiologists, infectious disease specialists, anesthesiologists because of a respiratory disease. But who then was in charge to taking advantage of the previous experiences? You know, we faced first wave, second wave, and did we really learn something from the previous one? I don't think so. At least in Italy, you know, the second wave was worse than the first one. And this is because, this is my feeling, we lack education, we lack perspective on disaster cycle management and disaster medicine.
Thank you, Roberto. Dora, I wonder, did you want to comment on that? You look a little bit skeptical.
Sorry, I wasn't. No, it was very well said. I mean, all of us have been thinking after the first wave, why weren't we better prepared for the second one? Maybe from a healthcare perspective, I must say, looking within the pharma, we reacted very, very fast. We were struck by surprise first when we were taken by surprise when the COVID struck, but immediately everybody was on the feet to pull up projects to see how we can cope with the new situation. How can we improve first continue and even improve the direct communication with patients and with healthcare professionals out there. And then we thought maybe it's now over when summer came, but we didn't stop going on with this project. So we didn't stop going on with this initiatives. And I must say everything was in place when the second wave also struck. And I would have liked to see this European-wide or worldwide, this learning from the first phase, being prepared, being resilient during the second phase. Now we are even in a third phase, and we need to look forward, but we need to ask ourselves always a question: what have we learned, and are we prepared for another wave or for another pandemic? I think this is the most important question that we need to ask ourselves right now. And I fear that the answer will still be no. So we need to work on a better preparation.
Thank you. Paola, I would like to ask you just to maybe give your perspective on one of the recommendations, because I think it ties quite well to what we're saying as a good wrap-up. It says to strengthen a One Health approach to prevent future pandemics. What does that One Health approach mean to you? You're on mute. Thank you.
The One Health approach means two things. You know, first of all, that in the surveillance, so in the I would say in the phase before the outbreak, before an emergency, you need, you know, as I said before, to really monitor, you know, development in the environmental situation, in the zoonosis, in the animal health. So you have to think in mind, you have to keep in mind that the threats are coming from that world, animal, okay. But the question is that, so not only in the preparedness, so not only before, but also in the management of the emergency, you have always to maintain this One Health approach. So to think also that when you organize some intervention, you have also to think what is the impact, on the other part, of our life, which is again animal and environment. So while we tend to think that the One Health approach is only, in in surveillance. The One Health approach is in everything. Is in developing of of medicines. Is in organizing of the health systems. So it's an horizontal a horizontal approach which has to be kept in mind during war and in time of peace. So that war and peace, you understand what I mean?
Thank you very much. Yes, Paolo, I think we absolutely do know what you mean. I think now we've just got 10 minutes to go, so I'm going to hand over to the responsible for EU affairs, Mariano Volta. We would like to hear from Pascal. Unfortunately, he has a technical issue. So I think, Mariano, the floor is yours. I presume you've been heartened and interested by what you've heard in our discussion today.
Thank you, Jennifer. Thanks a lot for the great discussion that followed the first day of this 15th edition of the European Patient Day. My role is impossible to summarize the lot of topic and angles that will be discussed today, but probably we can try to identify, highlight some message and probably also some potential next step, because one of the requests is to try to identify actions that are required. The first point, from my perspective, of course, to the need to recognize the key role of citizen patient advocacy group in times of needed change for more resilient healthcare system, also to better address the cross-border threats to health. But in a very pragmatic way, we talk about data collection. Can we identify a role also of the patient advocacy group to raise awareness about the importance of the patient's data for them, for their healthcare professionals, but also for the public health? Can we identify the role of a patient advocacy group, for instance, in the already mentioned European Reference Network, or in general, the option offered by the cross-border implementation of the cross-border directive? I don't forget that within February it was open a public consultation in which we have also advanced some concrete proposals, taking consideration that for instance, in cross-border issues not linked with health, the European Commission already put in place something that we have a network on European Consumer Center Network. We can adapt this kind of solution or network, adapting a European Patient Center Network on this topic. Come back to the data collection, for instance, in Italy, the digitalization, the European in the national recovery plan covered 22% of the budget. So it's a key, and we are waiting to identify also in the issues of health if we can, some role of the patient advocacy group is recognized. The second point is that in this time, the institutions, European, national level, are called to listen and to involve the citizens in the conference of the future of Europe that will start in the 3 next days, but also in the interaction to identify the pillar of the recovery plan, and then in each member state, and then for its implementation. And are they interested to listen and to involve? This is still pending issue, so we are aware, and I agree with already said by Paolo Testori-Goggi, that the need to identify 2 parallel ways to try to work on existing treaty, but also to try to identify how to change, because if we need the European Health Union, we can probably imagine in the future some changing also in the treaty. And unfortunately, the European Commission, the European institutions have spent more than 1 year before to identify their joint declaration on the Conference of the Future of Europe, in which no chance to open the dialogue for a new change of the treaty is it was defined. And in the same day in which the joint declaration was signed, Eurobarometer survey already mentioned by the Commissioner Andrew Cates showed that some figure extremely interesting that I hope the institution can take in consideration. The European citizens want to see in Europe future comparable living standard, that in our perspective we can identify reduction of inequalities, and in our context on health, reduction of health inequalities. The second issues that are called is a stronger solidarity among member states. 30% of the citizens agree about it. We can translate to increased cooperation, and in our context, to probably build a more public-private partnership. Are also yesterday it was mentioned. The third topic is to develop a common health policy that is extremely in line with the message towards the European health policy. And for the citizens of 9 countries, including my country, Italy, health risks are a major concern. So I hope that all of these issues will be taken into consideration in the development of the Conference of the Future of Europe, and more in general in the European political debate. Point number 3 is linked with the recovery plan. Each member state at the end of April are define the recovery plan, probably the main tool to guarantee a more resilient healthcare system across member states in the coming years. Unfortunately, the level of engagement, involvement of the civil society, but also the professionals and several categories, it was quite low, at least in my country, but probably not only. So what is needed at this stage, it is essential to ensure better transparency, many times underlined also by Marco, but also to ensure much more participation, at least during its implementation. This is crucial, and this is allowed to me to try to identify what we can do, because we will try to do our part, as always, in a very concrete way. On the one hand, we're asking for an open government platform that enhance the transparency and the monitoring of fund allocation. We are already started in Italy with an initiative mentioned by Jennifer called Follow the Money, together with many organizations, of course. And thanks to our constituency, we are now thinking about how we can leverage the work for other member states. By the other hand, by contributing to the work of the Conference of the Future of Europe throughout a cycle of a European initiative, or probably European webinars that aim to put health-related issues at the heart of the debate. This will be the follow-up of this 15th European Patient Right Day. In addition, we have identified also a third initiative, because we are interested to produce a video message able to directly address the protagonists of the Global Health Summit, next 21st year in Rome plan. As you know, the global leaders and high-level experts will discuss how to improve health security, strengthen our health system, enhance ability to deal with the future crisis in a spirit of solidarity and better cooperation. Their goal is to create a Rome Declaration, which include the principle that can constitute a powerful guide for medium to long-term structural change. We'd like to point out to them also what emerged in this addition to the European Patient Right Day, but also the 10 recommendations produced thanks to the contribution and endorsement of the 33 associations. Finally, let's remember that this year we celebrate the first 20 years of activity of Active Citizenship Network. 20 years ago, my organization, Cittadinanza Attiva, took the wise decision to start working not only at local and national level, but also at European level. And our first advocacy tool, we immediately produced the European Charter on Patient Rights, together with many associations across Europe. That has begun one of the main milestones for those advocate for health issues across Europe. Now, in the light of the situation we are facing, we will work in the drafting of in a holistic way in a global health charter. It was mentioned by the Storigogi, global problems, global solution, but probably also global awareness on some topic. From a citizen patient's perspective, but a multi-stakeholder perspective, to emphasize the interconnection, duties, but also rights among all of us, closer and far, patients and caregivers, are all equally exposed to serious cross-border threats to health, and all equally called, which each one has a role, a function, to play an active role in support of the institutions and for the benefit of local communities and their constituency. So these are a very concrete way that we are identified as a follow-up of this European Patient Rights Day. And finally, please let me remind that this conference was endorsed by Member of European Parliament Brando Benifei and Tomislav Sokol, and realized with the support of Hoffman Laroche, Teva Europe, Boehringer Ingelheim, and Beatrice, which I would like to thank. At the same time, please let me thank our moderator. Thanks, Jennifer, today, and I want also to thank your colleague Brian yesterday. And I want to mention also our media partners, Health Europe, that also has already published some suitable article linked with this initiative, and the peer-reviewed journals Advancing Health and Behavior and Family Medicine and Medical Science Research that I want to thank as well. As always, let me thank my colleague and the staff of Active Citizenship Network. So grazie Daniela, Bianca, Manuela, Elisa, and to our communication office. We will soon send out our newsletter, comprehensive of all of the documents and the output of the 2 days conference. So please, underwriters of the story, please send out, if you wish, your speech and document, which we can spread and widespread this document, because are very well requested by our audience. Thank you all again. Stay safe. I think that the conference is finished. Goodbye from Rome. Arrivederci. Grazie. Thank you very much again.
Thank you very much.
Ciao.
Thank you.
It's a pleasure.
Thank
Bye.
you so much. Paola, thank you so much. I'm happy to see you.
Thank you. I'm waiting for you in Italy.
Oh, very good. I wish you big success in front of Global Summit of G20.
Thank you. Bye.
Oh, please keep in mind antimicrobial resistance and possibilities to have global convention on antimicrobial resistance, like we have enhanced tobacco convention. It was very excellent. It was time to have common methodology to monitor situation about antimicrobial resistance, because it's so dangerous situation around the world. Microbiome is in changes because of climate, and bacteria are in changing, and antibiotics are everywhere. And we can't.
Andreukaitis, we are also dealing with this topic, so probably we have to keep in touch also, because Ned agree, because we are working. We try to do our part as a citizens and patients perspective also on this aspect. It was the key, the topic of the last European Patient Rights Day, the antimicrobial resistance, and of course we are struggling also on this topic. Thanks again.
Thank you.
Grazie anche a lei.
Grazie.
Paola Di Storico oggi. Grazie, arrivederci.
Grazie.